Welcome back at 8:14. May marks National Asthma and Allergy Awareness Month. This is a rough time of year for asthma and allergy sufferers nationwide, making now the perfect time to educate the public about these medical conditions. Dr. Reena Mehta joins us now with details on why learning about these conditions, especially this month, can make a difference in someone's life. Dr. Mehta, good morning. Thanks for being with us.
Good morning. Thank you so much for having me.
So let's first talk about why this is such a rough time of year for people who have asthma and severe allergies.
So about 65 million Americans nationwide have asthma and or allergies. And so this is a rough time of year because, as you all can see outside, pollen is everywhere. And so when the pollen starts peaking and when it starts getting humid, especially in Louisiana, that really causes things like mold, dust, our famous cockroaches to come out and release their allergens.
Cockroaches you mentioned. What does that have to do with asthma and allergies? Do I even want to know the answer to that?
Probably
question?
not, because it's actually cockroach feces, cockroach poop that then gets aerosolized into the air that people breathe in, and they can actually have allergic reactions to it, and it can be a big reason why people have asthma flares in the inner cities.
Really? That is an interesting fact to learn this morning. All right, Dr. Mehta. Well, I know, again, we want to really make sure people are aware of these issues and know how to help. Parents typically know what to do if they suffer from asthma or allergies, or their children do, but we're about to go into the summer. Kids are going to be cared for by people that don't normally take care of them during the school year, heading into summer camps. What do care providers, child care providers need to know about asthma, especially asthma sufferers this time of year?
So that's a great question. So, I mean, like we just mentioned, asthma is very common. 1 in 10 people in Louisiana actually have asthma. So, you know, you're definitely going to come across campers, students, people with asthma. So one, I think being aware of, like, if you are the person suffering, being aware of your triggers. So whether that's allergens, whether that's smoke, whether that's pollution, better knowing your environmental triggers that can then exacerbate your asthma is very important. If you're not sure, then you should go see your local allergist, because we can do testing to figure it out. Now, if you have somebody who suddenly has an asthma exacerbation, obviously if there are inhalers around, that is an important thing to try to get the child. So things like an albuterol rescue inhaler can be helpful.
And know how to use those properly, correct?
Exactly, exactly. And then also there are a lot of over-the-counter medications that you can get. I mean, if it is an allergy flare, then taking your, over-the-counter antihistamine can be helpful. There are some over-the-counter inhalers that you can get as well. But ultimately, it's knowing your triggers, being aware, and then being prepared. So if you suffer from this, actually going to your doctor and coming up with a plan. Okay, what do I need to take to control this? This is the time of year, every single year, my asthma flares in the summer. Okay, what do I need to do? Have your emergency medications there, have your controller medications that you take every single day, so that then you're not dealing with these exacerbations.
And for parents, maybe share that, definitely share that plan with the caregiver, with the day camps, with the sleepaway camps, so everyone is on the same page should an issue arise.
That's absolutely right. So you should have your rescue inhalers at camp, at school, and a lot of times you'll need school notes for it, and your provider should be able to take care of that for you. But making sure that everybody is on the same page. And then another thing is like staying active. So a lot of times people feel, oh, I have asthma, I can't go for a run. Actually, it's the opposite. You want to stay fit, you want to be fit. You don't want to be obese, because those are risk factors for having more asthma exacerbations.
And more severe asthma exacerbations.
Absolutely.
Dr. Mehta, good morning. Thank you for your, good morning again. Thank you for your time this morning. We appreciate it.
Thank you so much for having me.